Doctors warn 6 deadly symptoms you should never ignore after 60. Please leave 1 subscribe, 1 comment, and 1 like for this valuable video of yours. And don't forget to share it across social media to help others stay informed. As we grow older, our bodies give subtle but serious warning signs that something may be wrong. After age 60, certain symptoms can be life-threatening if ignored. This video reveals 6 deadly symptoms every senior must watch out for. Whether it's persistent fatigue or sudden weight loss, recognizing these signs early can save lives. Stay informed, stay safe, and help others do the same by sharing this important message. Doctors. Warn Lesson 1. Chest pain isn't just heartburn. Many older adults tend to dismiss chest pain as simple indigestion or heartburn, especially after eating a heavy meal. But here's the truth. Not all chest pain is harmless, and ignoring it could be a fatal mistake. After the age of 60, the risk of heart-related issues increases significantly. What may feel like a burning sensation or tightness in the chest could actually be an early warning sign of a heart attack or angina, especially if the pain occurs during physical activity or emotional stress and goes away with rest. Chest pain related to the heart is often described as a feeling of pressure, squeezing, fullness, or pain in the center of the chest. It can last more than a few minutes, or it may go away and return. The pain may also radiate to the neck, jaw, shoulders, arms, or back. Other symptoms like shortness of breath, nausea, cold sweat, or dizziness might accompany it. These signs should never be ignored. Unlike heartburn, which typically occurs after eating spicy or fatty foods and is relieved by antacids, heart-related chest pain is unpredictable and can strike at any time. If you or someone you know experiences sudden or unexplained chest pain, call emergency services immediately. Time is critical when it comes to heart issues. Early treatment can mean the difference between life and death. Stay alert. Listen to your body. It might be trying to save your life. Doctors warn Lesson 2. Sudden weight loss is a red flag. Losing a few pounds here and there can be normal, especially with lifestyle changes or improved eating habits. But if you're over 60 and notice sudden unintentional weight loss, especially if it's 5% or more of your body weight within 6 to 12 months, it could be a serious warning sign. Doctors warn that unexpected weight loss in older adults should never be ignored. It might be the first visible symptom of a deeper issue, such as cancer, thyroid disorders, diabetes, chronic infections, digestive problems, or even mental health conditions like depression. One of the most concerning causes is cancer, especially in the colon, pancreas, or stomach. These cancers often grow silently but can trigger rapid weight loss as they disrupt normal bodily functions. Other common culprits include an overactive thyroid, hyperthyroidism, which speeds up metabolism and burns calories quickly, or malabsorption syndromes, where your body isn't properly absorbing nutrients. Sudden weight loss can also lead to muscle loss, weakened immunity, fatigue, and even frailty or increased fall risk in the elderly. If you or a loved one notices clothes fitting looser, a smaller appetite, or a sharp drop on the scale without trying, it's time to talk to a doctor. Early testing can identify the cause, and in many cases, early treatment can prevent a minor issue from becoming life-threatening. Your body is speaking. Pay attention before the whisper becomes a scream. Doctors. Warn Lesson 3. Shortness of breath can be a silent danger. As we grow older, it's easy to assume that shortness of breath is just a natural part of aging, or a sign that we're out of shape. But doctors warn that this common symptom can be a silent danger, one that may signal serious heart or lung problems. If you find yourself getting winded from simple activities like walking upstairs, carrying groceries, or even talking for long periods, don't brush it off. Chronic or sudden breathlessness could point to conditions such as congestive heart failure, chronic obstructive pulmonary disease, COPD, pulmonary embolism, or even coronary artery disease. These conditions can develop gradually and often go unnoticed until they become life-threatening. Shortness of breath may also be accompanied by fatigue, chest discomfort, a racing heartbeat, or swelling in the feet or ankles. Even without pain, these signs can indicate your heart or lungs are struggling to get enough oxygen to your body. Sometimes, breathlessness can be a symptom of anemia, especially in seniors, or anxiety disorders, but even these require medical attention. Don't wait until you collapse or experience a full-blown emergency. If you're frequently short of breath or notice it worsening over time, consult your doctor immediately. Early detection can make all the difference when it comes to managing or reversing a serious condition. Breathing should never feel like a struggle. When it does, it's time to act. Doctors warn, Lesson 4. Memory loss isn't always normal. It's common to misplace your keys or forget someone's name now and then, especially as you age. But when forgetfulness becomes frequent, disruptive, or severe, it's more than just getting older. Doctors caution that rapid or noticeable memory loss could be an early sign of Alzheimer's disease, dementia, or even a stroke. Mild memory lapses might be normal, but watch for red flags. Forgetting important appointments or events, repeating the same questions or stories, struggling to follow conversations, or getting lost in familiar places. These are not typical signs of healthy aging. In some cases, sudden memory loss, especially when paired with confusion, trouble speaking, or balance problems, can be a symptom of a mini-stroke, transient ischemic attack, or a full stroke. Acting fast in such cases can save brain function and even life. Memory loss can also be linked to other medical conditions such as thyroid imbalances, vitamin B12 deficiency, depression, or side effects from medication. The key is to notice the pattern. Is the change gradual or sudden? Is it interfering with daily life? Early detection of cognitive issues gives you and your family more options: medications, lifestyle changes, support systems, and planning for the future. Don't dismiss memory loss as just aging. If you or a loved one is experiencing significant changes, seek medical evaluation as soon as possible. Your memories matter. Guard them with awareness and timely care. Doctors warn, Lesson 5, persistent fatigue may be more than tiredness. Feeling tired now and then is part of life, but if you're constantly drained, even after a full night's sleep, it could be a sign that something deeper is wrong. Doctors warn that persistent fatigue in seniors should never be ignored. It may be your body's cry for help, signaling anemia, depression, heart disease, thyroid problems, or even chronic fatigue syndrome. Fatigue that interferes with your daily activities, like struggling to get out of bed, losing motivation, or feeling weak while doing basic tasks, is more than just being tired. Anemia, for example, is common in older adults and means your body isn't getting enough oxygen, leaving you feeling constantly exhausted. Thyroid disorders, especially an underactive thyroid, hypothyroidism, slow down your metabolism and can make even simple tasks feel like a burden. Depression can also express itself not through sadness, but through physical exhaustion and a lack of energy. And in some cases, fatigue may be an early warning sign of cancer, kidney disease, or heart failure. The key is to recognize fatigue as a persistent pattern rather than an occasional slump. If rest doesn't help and your tiredness is affecting your quality of life, it's time to consult your doctor. Blood tests, lifestyle reviews, and medical assessments can help pinpoint the cause. Don't ignore what your body is trying to tell you. Chronic fatigue is not a natural part of aging. It's a signal worth investigating. Doctors warn, Lesson 6, blood in stool or urine must never be ignored. Seeing blood, no matter how small, in your stool or urine can be alarming. But even if it seems like just a trace or happens only once, it should never be ignored, especially after the age of 60. Doctors emphasize that this symptom could be a warning sign of colon cancer, kidney disease, urinary tract infections, or internal bleeding. Blood in the stool might appear bright red, maroon, or even black and tarry, depending on where the bleeding is coming from in your digestive tract. While it could be caused by something as minor as hemorrhoids, it can also be a sign of colorectal cancer, which becomes more common with age. Early detection here can be life-saving, as colon cancer often develops without pain or other symptoms in the beginning. Blood in the urine, on the other hand, may be caused by bladder or kidney infections, kidney stones, or cancers of the urinary tract. Sometimes it's visible, and other times it's only detected through a urine test. Either way, it's a symptom that needs urgent medical attention. The bottom line: do not delay seeking medical advice if you notice blood where it shouldn't be. It might not be serious, but if it is, catching it early could mean the difference between a minor treatment and a major health crisis. Listen to your body. It often whispers before it screams. Catching these warning signs early can save your life. Conclusion: your body speaks, especially after 60, and it's up to you to listen. These 6 symptoms may seem minor, but they can be deadly if ignored. Don't wait until it's too late. Early detection saves lives. If you or a loved one experiences any of these warning signs, see a doctor immediately. Stay informed, stay proactive, and protect your health in your golden years. Please don't forget to subscribe, leave one like, and one comment to support this valuable content. And share this video with someone who needs it. Your action today could help save a life tomorrow.